could I take this opportunity to introduce Dr. Ryan Hodges from Monash Health. Dr. Hodges is one of the country's leading experts in managing complex pregnancies and particularly the issues relating to pregnancy and vaccinations. And I just wanted to preempt what he's saying by just making it clear that as of tomorrow, any woman who is pregnant from 24 weeks onwards in their pregnancy will be able to get priority access through any of our state-run vaccine centres in the same context that our frontline healthcare workers and aged care workers are able to. You are a priority group, and it's important that you and your support, be that your partner, be that your home-based supports, also get vaccinated as soon as you possibly can for the reasons that Dr. Hodges will take you through. So could I please hand over to Ryan and then Kate, and then we're happy to take questions.
Thank you, Minister, and good morning. We run a very busy maternity service at Monash Health. We deliver 10,000 babies every year, and we're the state streaming site for women who have COVID in pregnancy. And I'm here today on behalf of my team to tell you that we're very worried. What we've seen over the last week has caused alarm. We have lots of women now who are very sick, who are very high risk of having their babies who need to be born early. We know that in pregnancy that coronavirus infections means you're 5 times more likely that you're going to need to come to us at Monash. And when you do come to us at Monash, there's a 1 in 3 chance that you're going to need oxygen therapy. There's a 1 in 7 chance you're going to be in intensive care. There's a 1 in 2 chance you're going to need emergency delivery of your baby. There's a 1 in 2 chance of caesarean section. And there's a 1 in 4 chance that your baby will need to be born prematurely. You're twice as likely to have a stillborn. This is what we're seeing from the Delta variant of the coronavirus. This data is actually not new. We've known about this from North America, we've known about this from the United Kingdom, we've known about it from throughout Europe, but we're now seeing it here. At the moment at Monash Women's, we have 7 women who are pregnant who are in hospital, one of whom is in intensive care at 24 weeks gestation with a 600-gram baby. She is unwell. We have 26 weeks, we have 28 weeks, we have 30 weeks. There's a very high risk of needing extreme premature births due to the degree of their infection. We have also looked after in the last few days women at 38 weeks who are giving birth in our hospital when their support persons and other children are at home sick. They have been unable to come to hospital. We're using FaceTime. We're using all the digital technologies that we can to try and keep families together. But what we do know that keeps families together is vaccination. It is now we need to start to shift our care of pregnancies. It's no longer what do I avoid in pregnancy to keep my baby safe. It is now what do I do in pregnancy to keep my baby safe, and that is vaccination. Over 200,000 women now internationally in the US and the UK have had Pfizer vaccination in pregnancy, and we know it is safe. It does not increase the risk of miscarriage. It does not increase the risk of abnormalities in your baby. It does not increase pregnancy complications. It prevents severe disease. It prevents you coming to Monash. It prevents you having your baby born early and putting to our intensive care unit. It is safe. When you look at the side effects of women in pregnancy who have had vaccination, they are actually less likely to get a fever than in the non-pregnant group. The immune protection response actually crosses the placenta to the baby. It provides protection to the baby. For women who are breastfeeding, the vaccination response, not the vaccination response crosses in breast milk to continue protection to the baby. We have a mother came in last night with her baby who is also positive now. And overwhelmingly, the women and families that we are looking after, they are not vaccinated. So I'd just like, on behalf of my team especially, to thank the Minister and the Government for this announcement today to prioritise women from 24 weeks gestation to have immediate access to vaccination. We are concerned. It is very early on in this next wave, and what we are seeing is not what we saw in the last wave. This is not what we see with influenza. Never would I have 7 sick women in hospital with influenza. This is different. Vaccination is safe. It's safe for your support person. We want support persons with you. Our team are working so hard and I'm so proud of them, and I need to give them a shout out because I can't tell you the amount of work that our team are doing at the moment to keep everyone safe. And once again, I'm just very grateful for the announcement today. Thank you.
Can you just explain why being infected with COVID increases the risk factor for stillbirths and ICU admission, all those kinds of things? What about it poses danger to pregnant women in particular?
Yeah, in general, the immune system just runs a bit low in pregnancy, and we've known that for a long time, and that's why women with influenza, for example, often have worse outcomes, and that's why we recommend immunisation for influenza in pregnancy, for example. The immune system runs low, and in later pregnancy with a bigger tummy, the work that the heart and lungs has to do is increased. And then if you then become unwell, you are then more likely to have worse outcomes. It follows what we've known for respiratory illnesses in pregnancy. The problem that we're seeing is that the severity is actually higher. And what we're worried about is that this takeoff in pregnant women that we've seen over the last week that we're seeing at Monash.
In your conversations or your colleagues' conversations with the women who are coming in, are you finding that there's been confusion as to whether they're eligible, which vaccine they're eligible for, and whether those vaccines are safe for them? Has the information to them on vaccines been insufficient?
No, I don't think so. The information's out there. I mean, ATAGI has a very important statement, as does RANZCOG, the College of Obstetricians Gynecologists, as does the College of Midwives. So the information is certainly out there. It's just how do we reach them? How do we reassure? How do we engage trust? That's really the challenge. And of course, we understand it's scary. And women don't want to take a Panadol in pregnancy. We understand that. And the question I always get is, but Ryan, I don't know the long-term outcomes of the vaccination in pregnancy. And absolutely, that's right. But equally, we don't know the long-term outcomes of COVID in pregnancy. But what we do know now is that COVID in pregnancy increases the likelihood of very severe disease. It increases the likelihood of having your baby born preterm. And a preterm baby is more likely to have worse health outcomes in the long run. So that's what we know, and that's the challenge.
What is it about the 24-week mark that makes it priority for women to go and be getting vaccinated beyond that, obviously in our state-run hubs, and is it safe to do it before then as well?
Yeah, we would encourage pregnant women to have the vaccination as soon as they can and at any stage in pregnancy. On all of the studies that have been done, the studies have been done at every trimester. So even in the first trimester, where the precious little baby is developing, it is still safe. And so it's important that vaccination just occurs. 24 weeks is a really important time because that's when the baby is viable. Now, we don't want to be delivering babies at 24 weeks. These babies are tiny. They have significant short-term health problems, significant long-term health problems. We don't want to see them at 24 weeks. We want to see them big, fat and strong at the end.
Have you had cases of babies not surviving because of a COVID-infected mother?
Not yet.
Do you fear, though, that it's a matter of time?
I hope not.
When you look at the numbers?
Yeah, I hope not. I hope that this message is going to start to get out. That's why I'm here. I'm here because of what I'm seeing, what my staff are seeing. The patients we have at the moment, as I said, all 7 of them, they are very sick. Now, that's not to say that all pregnant women who get COVID in pregnancy are going to have severe illness. In fact, half of them are actually still relatively mild. But we can't predict that. We do know women with diabetes, women who are overweight, women with blood pressure, other health illnesses, yeah, they're more likely to have severe disease. We know that. But the women I've got in hospital at the moment, they actually don't have that.
Do those women express regret about not getting the vaccine before they got sick?
That's not a conversation we're having. We're just there to provide the very best of care. It's not a conversation we're having at the moment.
Are they coming from the west and north, most of these women?
Yes.
And how difficult does it make it for your teams? Obviously, if a woman is giving birth and is COVID positive, she can't be wearing a mask and things like that. How do you manage that risk to your team?
Yeah, I mean, our staff they're tired. It is really hard work. You all know about the PPE, the gowns, the gloves, the visors. I have a pressure injury on my nose from the mask. We have to be very, very careful in terms of staff as they move in and out. Giving birth to a baby, pushing, these are aerosols that come up into the environment. This is actually risky for our staff. We need to make them as safe as they possibly can. And there are risks to the babies.
The Minister spoke about the priority for vaccinations for pregnant women, that they've already been in the priority queue, but now they're in a better priority queue. Are you able to explain what the difference is? You may not know.
Yeah, I might leave some of the specifics, but I think any way that we can improve access at this time is certainly to be welcomed. And so they can have access particularly to Pfizer, because the important message here is that we are recommending the Pfizer vaccination in pregnancy as opposed to AstraZeneca, just given the much more experience of the Pfizer vaccination, mostly from North America.
Have you had pregnant patients who haven't been able to access a jab and that's why they haven't got it thus far?
I have pregnant patients of my own who have certainly booked and registered to have the vaccination and are waiting, and so they'll be delighted with this outcome.
We're obviously expecting case numbers to grow over the next weeks, months. What kind of impact are you expecting that to have on people trying to give birth and on hospitals, on maternity wards?
Yeah, it's a significant impact. You know, if we have a lady yesterday who we delivered in our birth suite, we then have to take 2 other birth suite rooms and keep them free to enable our staff to be using all the safety equipment that they need. So there is an impact on the system. There's no question about that. And so that then raises concerns about access to care for women without COVID. And we're working in all the various maternity services about how we can provide access. The birth rate is lifting. We've got some very, very busy months ahead. So it is a challenging time.
Are we going to get to a point, do you think, that there will be wards where only, much like it is in other hospitals where there's COVID wards, is that going to have to be the case for maternity wards? Because I imagine having a COVID positive mother anywhere near a not COVID positive mother is a significant risk, particularly with staff moving between.
We've already implemented a COVID maternity ward.
And that's at Monash?
Yes.
At what point does that
Last
COVID?
question.
At what point does that COVID ward reach capacity at Monash?
Thankfully, through all of the forward planning that we've been doing, we actually can increase capacity. But the challenge is, as the state's largest provider of maternity services, what happens to everybody else? And so there are the discussions at the moment. So how we can always provide access to the very best care that we're renowned to give.
Does it take more staff to when a COVID positive woman is giving birth in that process? Is it more staff heavy, say, than a normal birth?
Yes, it is.
In like how many more roughly?
It's a bit difficult to say. It depends on gestation and nature of the birth, whether it's a vaginal birth, whether it's in the operating theatre and so on. You can imagine the scenario of the emergency caesarean section in someone who is unwell with COVID, so that we can safely get her from the birthing suite to the operating theatre and the baby safely to the nursery without risking our healthcare workers, without risking spread throughout the hospital, and providing the absolute very best of care. That is technically challenging, and that's why I'm here.
Can I just ask Kate a really quick question? Sorry, I know we're